Breastfeeding has been described as one of the most important ways to give every child a healthy start in life. The report.
More than 450 newborn babies have been recorded across 18 local government areas of Cross River State during the activities marking the 2026 World Breastfeeding Week. Over 420 of the babies were reportedly put to the breast within 1 hour of birth, highlighting increased awareness of the importance of early initiation of breastfeeding. The first hour after birth is critical for newborns. In Cross River State, nutrition focal persons monitored breastfeeding practices across health facilities during the 2026 World Breastfeeding Week, recording more than 450 newborn babies across 18 local government areas. Available records from some of the local government areas include 42 babies in Nikom, 35 in Yala, 37 in Obudu, 21 in Ogoja, 19 in Obubra, 18 in Buki, 34 in Calabar Municipality, and 27 in Calabar South. The records also captured multiple births, including a set of twins in Calabar Municipality and 2 sets of twins in Obudu. The exercise formed part of efforts to track early initiation of breastfeeding and strengthen public awareness of exclusive breastfeeding. Led by the Director of Nutrition at the Cross River State Primary Healthcare Development Agency, Dr. Winifred Oga, nutrition professionals carried the message of exclusive breastfeeding to mothers, families, and members of the public.
So we are also promoting what every other person around the world is promoting: early initiation, skin-to-skin contact at first hour of birth. Baby should be placed on mother's chest. Let baby initiate suckling within 1 hour of birth. If that is done, it prevents discarding of colostrum, it prevents giving baby prelactal, and it also helps the letting down of the milk immediately. It also prevents a mother from postpartum hemorrhage and helps a mother to expel the placenta almost immediately. These are all the benefits when we talk about early initiation and exclusive breastfeeding. So for Cross River State, we are promoting these things, and we are hopeful that the woman will be supported by her husband, her mother-in-law, her grandmother, her siblings, her family members, the community, the church, to ensure that exclusive breastfeeding is carried out properly by our women in Cross River State.
Sensitization activities were extended beyond health facilities to churches, mosques, markets, and other public spaces where religious leaders, mothers, and community members were engaged on the nutritional importance of breastfeeding. The campaign also focused on the economic benefits of exclusive breastfeeding and the role of families and communities in supporting breastfeeding mothers.
We have to give importance to the health of our children and the breastfeeding of the babies. It is so important for their growth. It is so important for the development of brain and so on and so forth. It's not just only that the world is saying it. It is also in the Quran that you have to breastfeed your children for 2 years. So if it is in the Quran, then you have to support whatever the government is doing, because not following all these directives by the government will definitely lead to something. It will have repercussions on the health or on the growth of the babies.
Breastfeeding, according to the professionals in the medical field, is one of the best things that make a child grow very well, and they prevent him from all other communicable disease. So that is why we emphasize today in the mosques for people to encourage their mothers for breastfeeding exclusively.
It's a situation whereby a baby is born and cannot eat any other thing apart from breast milk, and naturally it's only mothers that can breastfeed a child. It's advisable for every mother to breastfeed her child.
Basically, the exclusive breastfeeding, at least for 6 months. Yes, even if the child had started eating solid food, you can still breastfeed your child, because the breast milk is very important, as a matter of fact, to the child's health. Yes, it helps them not to get sick easily, and it also helps them to be very healthy, honestly. And it will also help the mother not to spend unnecessarily.
For mothers with newborn babies, the support and information provided during the campaign are helping them prepare for the demands of breastfeeding.
It's important for the child growth and other stuffs. So they initiated the exclusive. Corona is going well.
They say breastfeeding is good for the mother and the child. That breastfeeding makes the child to grow. Say some children, because of poor breastfeeding, they are short more than their age. So when we are breastfeeding, our children will grow. They will have knowledge and understanding. A child putting breast the first time, there is anxiety. Sometimes you feel the pains as I'm breastfeeding. I feel sometimes pains, but it's very good because the child is enjoying it.
That has always been my dream. The only reason why I got formula was because nothing was coming out. So immediately I started getting breast milk. I'm more than willing to continue exclusively. I feel like a woman. I feel like a mother.
Breastfeeding should be done exclusively for babies for 6 months, and then it can be now after 6 months complementary feeding can be done with inclusive of breastfeeding for 2 years.
The 2026 World Breastfeeding Week theme, Breastfeeding for a Sustainable Start in Life, Strengthen What Works, calls for sustained action and support for breastfeeding, particularly early initiation and exclusive breastfeeding. The UNICEF Field Office says continued investment in breastfeeding support, community engagement, and evidence-based nutrition intervention remains important to improving breastfeeding outcomes.
Breastfeeding is the foundation for life. The early breast milk, which is the colostrum, the first 3 days, is the child's first immunization. It is the child's first immunization, and it protects the child from even abdominal colic because it's robust and it purges the child of all that he has taken that are not healthy. We call them meconium, the black stool, and then clears the gut, the child's stomach, to receive adequate nutrients from the breast milk. So I encourage mothers to breastfeed, to be able to bond with their children, to minimize all the delinquencies we are seeing today, and to ensure that the child sucks intelligence, the child learns to smile, the child learns to love, the child develops well and never falls ill, and the child learns to grow in a larger society, because at the end of the day, a well breastfed child has more intelligence acumen and can participate in school and complete school years, and then gain a well-paid job in the future, which is an economic benefit to the country.
The Cross River State Ministry of Health and the Primary Healthcare Development Agency, in collaboration with UNICEF and other partners, have continued routine sensitization of pregnant women, families, and the general public on the nutritional and economic importance of exclusive breastfeeding.
We understand the importance of breastfeeding and exclusive breastfeeding as Cross River State government, and that is why His Excellency supported the 6 months paid maternity leave for women who have just delivered or put to bed. And because we want a better future for our children, currently the statistics are not looking good. We are 23%, according to National Demographic Health Survey, of exclusive breastfeeding rates in Cross River State, and we want to up that by before 2030. And the only way we can do that is to ensure that we carry out active sensitization in all the platforms and places we need to do, because people need to hear why we need to involve in exclusive breastfeeding, why our mothers need to engage in exclusive breastfeeding, because of the future of the children.
The recent monitoring exercise shows progress in early breastfeeding initiation across Cross River State, although nutrition stakeholders say more work is required to improve the state's breastfeeding indicators. Collins John, CRBC News Scoop.